A virus rarely mentioned outside scientific circles is once again drawing the attention of global health authorities in 2026. The virus is Nipah, a zoonotic pathogen known for its high fatality rate and its close association with fruit bats. While case numbers remain limited, officials say the severity of the disease warrants close monitoring. Nipah virus was first identified in 1999 during an outbreak in Malaysia that affected pig farmers and led to more than 100 deaths. Since then, sporadic outbreaks have been reported primarily in South and Southeast Asia, including Bangladesh and India. Unlike many common viral illnesses, Nipah outbreaks tend to be small but severe, with reported fatality rates ranging from 40 to 75% in past events. Health agencies emphasize that Nipah is not new, nor is it spreading widely. However, renewed detections and increased surveillance in early 2026 have brought the virus back into public discussion. Authorities say the concern is not about rapid transmission, but about the potential impact when infections occur. At the center of Nipah virus transmission is a group of animals known as fruit bats, scientifically classified within the Pteropodidae family. These bats, often referred to as flying foxes, are considered the natural reservoir of the virus. Research shows that Nipah circulates among these bats without causing illness, allowing the virus to persist in the wild. Human infections typically occur through spillover events. Fruit bats feed on fruit and tree sap, and the virus can be transmitted when humans consume food or drinks contaminated with bat saliva or urine. In some past outbreaks, livestock, particularly pigs, served as intermediate hosts after being exposed to contaminated fruit. The virus then spread to humans through close contact during farming or slaughtering activities. Health officials note that Nipah virus transmission generally requires close or specific exposure. There is no evidence that the virus spreads easily through casual contact or through the air over long distances. Most documented cases involve direct contact with infected animals, contaminated food products, or bodily fluids from infected individuals. Once infection occurs, symptoms can develop anywhere from 4 days to 3 weeks later. Early signs are often nonspecific and may include fever, headache, muscle pain, vomiting, and fatigue. These symptoms can resemble those of many common illnesses, which can complicate early diagnosis. In more severe cases, the virus affects the respiratory system and the central nervous system. Patients may experience difficulty breathing, confusion, drowsiness, seizures, or acute encephalitis, which is inflammation of the brain. Medical professionals report that neurological complications are a defining feature of severe Nipah infections. Currently, there is no approved antiviral treatment or licensed vaccine specifically for Nipah virus. Medical care is supportive, focusing on managing symptoms and maintaining vital functions such as breathing and hydration. Health authorities typically respond quickly when Nipah cases are identified. Measures may include contact tracing, quarantine of close contacts, temporary movement restrictions, and enhanced surveillance in affected regions. Environmental and ecological factors also play a role in Nipah virus emergence. Scientists have linked spillover events to increased contact between humans, livestock, and wildlife. Deforestation, agricultural expansion, and urban development can disrupt bat habitats, increasing the likelihood of human exposure to bat-contaminated food sources. Public health officials advise that basic food safety practices remain effective in reducing risk. These include washing and peeling fruit, avoiding consumption of raw or unprocessed tree sap, and minimizing contact with sick animals. For now, health authorities say Nipah virus remains a monitored but contained risk. Surveillance efforts, early detection, and targeted public health responses are considered sufficient to manage current cases. We will continue to follow developments as health agencies release further updates.